steady.
Okay.
Sometimes your mind takes over and you think, oh my God, there it is again.
Yeah.
You know, but
No burning with urination.
no.
No blood in the urine.
No.
Any
No.
problems with having to go a lot, or
No, just it seems natural, really. Go a lot at night because I try to drink a lot of water during the day.
Okay. The bowel movements, Betty said, still a little bit loose. Some.
Yeah, sometimes I pass a little mucus, and I have a little bit of diarrhea, but I just take an ammonium and it takes care of it.
No pain or blood.
No.
Okay, good. And I saw Dr. Galay's note. He's waiting for the CT.
Oh, is he? Because I put his name on it.
Yeah,
when I was there.
Good.
Do you want to sit here so you can see clear?
So the bladder looks pretty good. There's still a little bit of like thickening back here, but that could just all be scar tissue. So, Dr. Galay's will look in there and check that out. So just a little thickening back there. Now, one of the things he was waiting to see was if there's still a backup up here, and that's still there. So in his note, he said that was going to be the difference about whether he did the scope in the office versus taking you to the operating room. And so with that there, that means he would probably, what he said in his note is they would take you to the operating room. And so, look in there with the scope at the bladder.
Yeah,
and
he
then,
said he wanted to examine the kidney too.
Yeah, so see if they can get the stent up there to open that up and let that drain out.
Oh, that would be good.
Yeah.
How about the chest?
The chest looked good. There's a couple small spots that were there in the fall.
Still there?
Yeah, and not changed. Yeah.
So is that nothing to worry about
Probably
then right now?
not. Probably not. You would just repeat the scans, in 6 months or so. The issue there is if you scanned everybody off the street, you're going to find lots of those.
Yeah.
And so you just have to follow.
I mean, when I was young, I had scarlet fever and all that kind of stuff. So maybe could be from
it's
that.
most likely nothing to worry about. There's a small chance that you keep following them, they start growing, or you get more.
I mean, I don't, seem to have colds
Mm-hmm.
or a lot of phlegm or, anything that I would be concerned about.
Mm-hmm.
I mean, not like I knew there was something going on
Mm-hmm.
with that.
You said something about there's still a backup, you see?
Yeah.
And
So
that
in
would,
the kidney.
and why do you think that
So,
is?
I mean, presumably before it was the tumor blocking the urine coming from the ureter,
Right.
to the
Yeah,
bladder.
Dr. Glee said he couldn't even see the
Right.
opening.
Right, and so the question is, if we did the radiation and, we killed all the cancer, but there's scar tissue, it might just be scar tissue or something.
So you see no growths?
No,
Yeah. Oh,
yeah, there's nothing, I can see that I'm worried about. He needs to look in there. I mean, with the bladder, that's
Right.
the best way to see it. But
right.
there's nothing big in the pelvis. The spots in the lung were the same. There was a couple lymph nodes up here before. They're all the same, unchanged. So, nothing that you go, wow.
So from before treatment to now, you see an absence of that growth.
Right. Yeah. There's nothing that's grown or progressed or shown that there's any. So, the big thing will be looking up there with the
Right.
scope and seeing
Right.
what that shows.
Right.
So her appointment with Dr. Merkel,
No,
Dr. Mack.
Macklin.
Merkel, that still has to see him.
Yeah.
That's the next Monday.
Mm-hmm.
What's with this?
I was gonna ask the same thing. November for the men
Yeah.
and recognition of men with prostate.
Shoot, I shave that every day.
Shh, that's a secret.
Every woman gets it, so that's no big deal.
Okay, so her seeing you again would be after the
I
cystoscopy?
would probably from here. I usually have you just follow with Dr. Mackler and Dr. Galais. They'll be following you along probably.
Yeah, Dr.
Would-
Glaze was
okay.
fun.
Mhm.
That was fun to see him. He said, "I'm so glad to see you're feeling better." And
I
do
don't like the
feel-
weight loss, but
Well,
it was
I don't
very
know.
significant from the
Food
last time.
just turns me off these days, and that's not like me. I mean,
No.
I'm a real picker, but I made baked chicken and
Mhm.
baked potatoes last night, and I could hardly get it down. I mean, I just gag when I'm eating.
Hmm.
So I don't know what that's all about, but
Mhm.
Could be age, you think? Maybe your diet's
I've lost 6 pounds since I was here last time.
Yeah.
But at home, I even lost more than that. I lost,
Yeah, see.
with all my clothes on, I was a couple pounds less. But
Well, but you would have had pretty much the same clothes on
Mhm.
here, so.
right,
And they have to
Is the
calibrate
medicine
their
that
scales
she's
here.
taking causing the appetite?
I don't have any medicine, honey.
You don't take it, not pills?
Oh, just my regular stuff that I take all the time.
You've been taking forever, probably.
Yeah.
The radiation stays in your system for how
So,
long?
I mean, it's as soon as the machine's off, the radiation's out of your body. It's a matter of, the changes in healing. But most of that stuff, recovers pretty quickly over a couple of weeks. So,
Because that's
Mhm.
one thing that Dr. Glee said to her with her bowel movement being
Mhm.
different, that it could be a side effect from the
oh,
radiation.
yeah, that definitely is, and that'll get better. But for some people, that doesn't go back to normal.
Well, it's not that bad.
Okay, that's good.
It's not that bad. I mean, compared to how I felt before,
Mm-hmm.
I feel like a new woman.
Good.
But I was afraid I was going to hear bad news.
I wasn't.
So,
I know.
any other tests that she has, will they send copies of them to you?
Oh, yeah. Mhm.
Okay.
Yeah, Dr. Glaze is very, very good about, sending me copies.
Do
of
they
medicine.
send copies to my regular physician?
You
Her
know, I
name's on
know-
everything
I know we do, and
because
I want to say, is it Dr. Simpson?
Dr. Simpson.
Yeah,
I was
so
there
I just
on the
saw that on Glaze note. Yeah.
I
so-
was there on the 13th of
Mhm.
October, and she's got a physician's assistant
Mhm.
in her office now. I was just there for a diabetic checkup,
Mhm.
and she didn't even come in and say, "How are you feeling? How are things going?"
Yeah.
And
Maybe
so
she was
I
busy
wondered
that
if she
day.
was upset because she wasn't getting copies of the reports. But I called her and told her that I was seeing Dr. Henning and Dr. Mackler,
Yeah, I
and they
know.
said they put it in my file.
I know ours would have gone out to Dr. Simpson and yeah, Dr. Glaze, in terms of like the surgical specialty people, he's about the best at getting letters of anybody I know. Yeah, his was sent to me and Dr. Simpson as well. So
Oh, good.
She was probably busy that day.
Well, I don't know, but I was just so shocked because I've gone to her for 14 years, and you would think that she would have just poked her head in
Yeah.
and said, "How you doing?" In fact, I was shocked when can't even remember his name because I was in such a shock that she was there. She walked down the hall right in front of me, and
Should have tripped her.
I was just
I
so
know.
surprised that she didn't say, "How's it coming along?" or "I've been
I mean, the other
keeping up
thing
with
is
you."
if you're like in a busy hallway,
It
like,
wasn't.
stop,
But
Well,
anyway, my diabetes was great.
Good.
I was 5.9, my A1C, and
What do they have you on for that?
Januvia.
Mhm.
And I've asked every doctor. Dr. Glee says, I said, "Do you know anything about it?" Because I see this. There's another one advertised on
Mhm.
television, and it says if you have any kidney problems, you're not supposed to take it.
Mhm.
And Dr. Gleese told me before he was going to do something, but he said your kidney has a problem, so I don't want to do anything to
Yeah.
aggravate it.
Mhm.
So I said to the physician's assistant, I said, and I've asked Dr. Simpson, I
Mhm.
said, "Will Januvia do anything with my kidneys?"
Yeah.
And Dr. Gleese said, it just makes you go to the bathroom a lot. That's all I know about it.
And that's when you started losing a whole bunch of weight with the
The
gym.
Januvia, yeah, I've lost probably
Nice,
35 pounds from what I was
Okay.
when I
When she
started on
started
the
the
Januvia.
Januvia.
Wow.
Yeah,
Within a month and a half,
I
she
weigh
lost 15 pounds.
175. I weigh 146 now. So
Okay.
But, I mean, when I
And the-
was younger, I only weighed 120 when we got married,
yeah.
so, you know, that middle age spread.
When was that?
A long
Yeah,
time
see,
ago.
that's what I told you yesterday when you
So-
told me my face was getting too.
Did they say Januvia does have an effect on
Yeah,
the kidneys?
it does, yeah, no. They said we aren't even talking the same, we aren't talking apples and oranges.
Yeah, I mean,
So
the
don't
kidney
worry
function
about it.
test you had the other day looked good. They looked a lot better than what you had. over the
Probably
course of
because they
treatment.
gave me a lot of liquid when I was there and I drank a lot of
Why,
water
what's the
before I
difference?
went.
What was it before and what is it now?
So, you know, they'll usually look at the creatinine and,
Right.
you know, yours was 1.47, 1.52, 1.39, 1.38, and the one the other day was 1.04, so.
And that's what
That's
what do
better.
you like it at?
Well, that's like the high limit of what they say is normal. You know, the other ones are a little high, but this is like the high end of normal, so.
Yeah, it's hard for me to drink a lot of water,
Mhm.
but I try to get at least 2 bottles a day.
Yeah, I'm not sure what to make of the weight loss, and the appetite,
Well, we just watch.
yeah.
I mean, I do eat, but I don't eat like I used to eat, you know?
And I wonder if that's the medicine or something, or change from that.
I don't know.
I don't know. I wonder about it, but I have no idea really.
Well, just keep an eye on it.
Mm-hmm.
You don't want to look like your dad. He was this big. He was,
Yeah, but he lived to be 88 years old,
that's true.
so.
So you're doing well, bouncing back. The bowels, you know, might keep improving over the next couple weeks, but you know, sometimes they don't go back.
Yeah.
Dr.
But I'm not
Mackler-
worried about it. It's not
Good.
that bad, Dr. Henning.
Good.
So you saw no
Not that I'm worried about.
growth.
Mhm.
She responded very well.
Yep.
I told you my body is so much like yours. After 2 treatments, they couldn't even feel I had a 6-centimeter tumor.
Mhm.
I said, you're just, our bodies are so much alike. Not look
Sorry,
alike.
Joanne. I didn't mean to get, I thought I escaped it. You know, there's 9 kids in our family. 8 of the 9 have
Wow.
had some kind of cancer. And
Well, since you met with him, we you were asking her questions about her brothers and her
Yeah.
sisters and what kind. I put together a spreadsheet
Yeah.
and a chart for her,
Mhm.
and she gave it to all her siblings so they
Yeah.
all know.
Oh, that's good.
But it was when you were
Yeah.
questioning her, and I said,
Yeah.
she said, I think it's a good idea that we put this
but
together.
I escaped to 82.
That's good.
Or I think I was 81 when I first came on, to tell you the truth, because I had a lot of problems before that. Before I was sent for an X-ray, I mean a CAT scan.
Mm-hmm.
But
Good news.
Yeah.
good news. Yeah,
So what are you guys doing for Thanksgiving?
my daughter had. Well, we're having